everybody.
Good afternoon.
We will begin our budget hearings for November the 25th, 2019. Our first budget hearing of the day is with our ADAMH board. And Dr. Kevin Dixon, if you'd like to introduce your team.
Sure, I'll be glad to do that. My name is Kevin Dixon. I am interim CEO for the Alcohol, Drug, and Mental Health Board of Franklin County, better known as ADAMH. And to my left is Mark Lambert, who is acting CFO, Catherine Carr-Harris, who is our Vice President for Clinical Services, and Jonathan Thomas, who is our Vice President for Planning and Evaluation. Want to thank you for allowing us to share some information about the services we fund here in Franklin County. And some good things are happening, and we continue to move forward with a transition plan for a new CEO. So just wanted to let you all know that as our board continues to continue with their evaluative process. So.
Wonderful.
Well, let me just start with the first slide here. The mission of ADAMH is to improve the well-being of our community through the reduction of an incidence of mental health problems and also the abuse of alcohol and other drugs. The information on the people that are joining me today, they're going to be sharing. The county commissioners have set some clear priorities for improving community conditions and reducing poverty. Much of the work that we fund supports these priorities by addressing the challenges that prevent our community members from being successful. Many of the people we serve experience barriers that keep them in poverty or barriers that lead them into poverty. The services we fund fall into 6 key areas that are listed up here: treatment, crisis prevention, housing, recovery supports, and family supports. No matter what the area of service that a community member receives, it is an opportunity for them to live healthier and more productive lives. We see ADAMH and the nonprofit agencies that make up the ADAMH system of care a place where better begins. If you can look here on the list here of all of our provider agencies, these are the agencies that we contract with for our community, and gives you an example of the entire network. But ADAMH is a comprehensive system of providers, programs, and most importantly, people who are committed to supporting those in our community who need care. It is important to note that this slide only captures the organizations that we contract with. Most of our work is accomplished with partnerships and other collaborations that are in the community, which go far beyond this list that's up here. There are about 39 organizations that we are part of our contract agency provider group, and we have a lot of other partnerships within various sectors of the community. ADAMH pays for direct services for approximately 20,000 enrolled individuals each year. Enrollment data suggests that 83% of the 20,000 individuals live below the federal poverty level, and 98% of the individuals live at 250% of the poverty level are covered within our system of care. The services ADAMH provides in the community align with the needs identified in the report Rise Together, a Blueprint for Reducing Poverty in Franklin County. One of the biggest challenges for our provider system is the workforce and recruitment issue. We are all challenged, especially with social workers in our community, with respect to attracting, keeping, developing, and retaining that workforce. So we are going to be initiating a workforce initiative starting in 2020 that's going to be hopefully working with a contract organization to help us better understand why folks are leaving the system. But generally, we can say that they're underpaid, and not really valued in our, in the community in general, but the work that they do is phenomenal. They address a lot of the community needs that people don't necessarily talk about, and it's hard to get folks that are probably making not much more than this poverty level here. Somewhere upward $45,000 some of the providers are able to pay. But when you have the VA, you have hospital systems, managed care firms, we tend to lose a lot of our workers. So we do see a lot of attrition in our system. So we're trying to figure out in a very strategic way, how do we keep folks in our system of care for continuity of services, as well as addressing some of the critical needs that the individuals who come to us are able to provide. So we're working on it. Yeah, I'm sorry.
Excuse me, Dr. Dixon, as you're talking about that in the ADAMH system, isn't that true for the entirety of behavioral health generally in our community? And don't we need to look at that as a whole in the entire behavioral health system?
We do, and I know Catherine works closest with a lot of the provider agencies that are sharing information. I'm not sure if you have anything to add, Catherine.
Yeah, many of our providers in our network are nonprofit organizations, and they're challenged to pay wages that for-profit organizations that have come into town can pay.
Yeah.
So we often see that we lose social workers in our nonprofit organizations to some of the private entities that have come to town, the VA, the managed care organization. So it is a problem across our system, not just the ADAMH system, but the behavioral
Right.
health care system in general.
Right, it is a concern that we've had generally as we look at the workforce in the healthcare field, and in particular in behavioral health. It is a concern that we've heard and that we see. So anything that you come up with, we would be interested in hearing more about it.
I also think social workers in general are in shortage. I know the child welfare system has experiences the same issue.
Absolutely.
So collectively, maybe we can work together in this county to try and problem solve this issue.
We've had some initial discussions with the OSU College of Social Work, and we talked to Tom Gregoire, the Dean of the College of Social Work, and he's very concerned as well. And we had someone submit to him, not from our shop, but one of our provider organizations, a request for a master's level social worker that started at $14 an hour. And Tom asked me, he said, we really should not be posting this. We've had people that have trained for 3 years. We really need to find a way to do better. And he said, I'm going to start rejecting some of these until we find better ways to ask folks to add a little more value to the quality person that they're going to get coming out of OSU. Interesting, I'm working with a group of young African-American professionals who said, we don't typically use your system of care. But as we were talking, and they're creating a program designed for folks that don't necessarily come to our agencies, and they're creating their own program that we're going to be investing and working with them to address some of the challenges that they see. A lot of them are the frontline workers, social workers or teachers. There are others that are in the system, but they need help themselves, and said that we don't want to go to the typical system. We want an alternative practice. So they're going to be creating something along with Mental Health America that they can go to. But one of the workers there mentioned this when we were all talking. She said, I love what I do, but I just can't afford to continue to work. And I said, well, put something down real quick so I can just have in my pocket anytime someone asks. She said, every month I worry about paying my bills, and this keeps me from being my full self at work and being my full self for my kiddos. And she said, and then at the bottom she put living wage. She said she has to go to her mother to borrow supplies and things like that just so she can stay, in her apartment and not have to worry about other expenditures. So I always keep this with me because it reminds us.
And the work is so important. And
Yes.
I think we have to pay attention to that. So thank you.
Good.
Thank you.
Let me go over there. Here are our annual investments into services out there in 2017 through 2019, $84,000 up through $103,000. And the numbers of people that are served, 96,000 in 2017, 121 in 2018 and 89,000 in 2019. But that doesn't include, because we continue to count those numbers up to the end of the year. Plus, we have about a 3-month lag where people can process claims. So that number will continue to rise as we come to the end of the year and into early next year, the first quarter of next year. So, but these are substantial numbers for those that are receiving prevention, early intervention, treatment, and recovery support services. First, we're going to focus on programmatic initiatives that align with the health priorities of the poverty plan. These are some examples of those initiatives that are lined up there. And before I turn it over to Jonathan Thomas to talk about the first one, take a look at the last two, Community Navigators for Community for New Direction. We funded them to work with ETSS, the Ethiopian Tawahado Social Service Organization, Dr. Celeste Yaspal, to do some outreach to new Americans. And they're providing services there in Reynoldsburg and other areas throughout the county to address those needs of immigrants and refugees that are and new Americans coming to Central Ohio. We also funded a Community Connectors program working with the Kappa Foundation, and that's also through Community for New Direction. And they are providing outreach and engagement for the African-American community on the Near East Side that are struggling with the opioid challenges. One of the things that the former CEO, David Royer, and I met with Byron Potts and also Kahari Inaharu said, when you're looking at opioids, do not forget the Near East Side. Do not forget the African-American community. And as a result, we're funding them about $153,000 this year to be able to do that outreach using the Narcan information kits out there and also the medication disposal bags that they're distributing, working with our faith-based institutions, working with community organizations and community leaders to ensure that we are looking at both sides of the equation in terms of what's happening on the outside of 250 or 270 and inside of 270 Beltway, to make sure that we're addressing all of those needs. And that was one of the pressures that we've got from folks within the community, that we don't forget the African-American community. I'm going to go ahead and turn it over to Jonathan, and he's going to share a little information about the Crisis Center.
Sure. Thanks, Dr. Dixon. So first I want to start by thanking the county commissioners for their support with the capital of this project we're working on. The $10 million is getting us closer to raising the funds that we need for construction of the Franklin County Mental Health and Addiction Crisis Center. I also would be remiss if I didn't thank some other partners that are involved. We've had a great group come together around this work, including the Franklin County Sheriff's Office, Office of Justice Policy and Programs, Public Facilities and Management. The work as a whole is co-chaired by the ADAMH board, as well as the Central Ohio Hospital Council, and it really has been a community-wide, cross-functional, collaborative effort where we're bringing together all 3 adult hospital systems, the City of Columbus, Columbus Foundation, Osteopathic Heritage Foundation, consumer family advocacy groups, as well as several providers representing the ADAMH network of care. It's been very exciting to work on. I will keep my remarks to the time that I was allotted for this, but it's definitely been quite an amazing project thus far. For some background, in 2018, there were around 30,000 crisis encounters, so someone experiencing a crisis related to a mental health or substance use disorder that presented at either net care or a hospital emergency department. About 70% of those encounters actually went to hospital emergency departments due to where the capacity to serve them was. However, across all the stakeholders that I've referenced, the consensus is that's not the optimal setting for individuals who are experiencing a mental health or substance use disorder crisis, with the exception of some who may have some medical acuity. But even when we adjust for that, and then we factor in some of the data we've received from our hospital partners, that's projecting a 23% growth in demand for these services over the next 10 years, and we understand that we really do need to right-size that part of the continuum of care. So what this project is it's really a continuation of work that many of you may have been maybe familiar with the Psychiatric Crisis Emergency System Task Force made recommendations for a crisis center along with some other continuum of care enhancements. And so this new steering committee that was formed earlier this year is really taking that work to the next phase. Services that are going to be included in the crisis center include a walk-in clinic, as well as an observation unit, on-site urgent care medical services to prevent the need for individuals to have to be transported back and forth to a hospital if they have some of those basic medical care needs, as well as linkage to community-based providers on-site in the facility to ensure warm handoffs and linkages to a broader spectrum of the services that individuals in crisis may need beyond dealing with the acute crisis they present with. So the project will result in enhancements to what we believe are vital aspects to the continuum of care, including the construction of a new center, but also other points along the way for the full system of care. And we believe this is critical to ensuring health of Franklin County residents. Those were my main talking points. So that's just one part of what we're doing right now on an upcoming initiative in terms of addressing the health needs. But Catherine Carr-Harris will talk about several other investments in that space for us.
Thank you, Jonathan. Good afternoon. As Jonathan said, I'm Catherine Carr-Harris. I'm the Vice President of Clinical Services at the ADAMH Board. And I am excited to talk about our new investments that focus on health, jobs, housing, and youth. Before I launch into our new investments, I just want to reiterate what Dr. Dixon said. A large part of our investment goes to fund treatment services for mental health individuals or individuals with addictions. So we're not going to talk about that, but that is tied to health. So a large part of our budget goes to promote healthy well-being for individuals in this county. The first initiative that I want to talk about is very exciting. It's the Near East Side Service Expansion. So this is a joint partnership with Primary One Health and Southeast Healthcare. They are located at 720 East Broad. They have come together to really infuse innovative services on the east side. So both leaders of those organizations, Charlita Tavares and Bill Lee, care deeply about the people who live on the east side. And they worked well together and hard together to really create this opportunity to integrate services on that east side. Primary One will offer general mental health services to individuals, and Southeast Healthcare will focus on services to individuals with severe and persistent mental illness. Mental health services include counseling, psychiatric services, case management, mobile psychiatric outreach, substance use disorder treatment, including medication-assisted treatment. Additional services provided through the partnership include pediatric care, OBGYN care, dental vision, diabetic and hypertension management, medication management, nutrition, transportation assistance. So it is a very comprehensive array of services that are going to be provided on the east side. In addition to that, Southeast Mental Health or Southeast Healthcare will be provided targeted outreach and engagement services. We've asked them to really go out, be on the ground, integrated with people in that community to engage them, let them know about the services that are going to be available. In addition to receiving funding from ADAMH, both organizations are federally qualified healthcare centers. And so that's important to acknowledge, and they will accept general health care insurance as well as Medicaid.
And Catherine, wasn't it true that these are the first two FQHCs that can co-locate?
Yes.
Yeah, in the nation?
Well, as far as I know, it's very unusual for federally qualified health centers to be located in the same area. They usually want them to be dispersed throughout low-income areas in the community. Both had to get waivers from HRSA to be able to co-locate in this location at 720 East Broad. Some of you were there at the grand opening. We were excited that they were able to open in this location. This is a temporary location. They are looking for a more permanent location to have even a bigger presence on the Near East Side. Going on to the...
Before you move on, if you don't
Yes.
mind, pardon me for my tardiness. I was finishing up a phone call that was important, so I apologize. But also, going back to the last slide, if you could,
Yep.
real quick. So this is a outcome of partially the closing of Columbus area, correct?
That is correct.
Do we know if 100% of the clients that Columbus area was serving have been assigned to either Primary One Healthcare or Primary One, mental health services or Southeast Healthcare? Do we know the 100% of those clients have been absorbed?
So I can speak to that. When Columbus area closed, we went into the Columbus area location and actually had my team as well as Columbus area staff that we contracted with for 5 weeks. We worked diligently to get as many of those individuals transferred to other providers. So at that time, Primary One wasn't a part of our network. We focused on the individuals with severe and persistent mental illness, and we tried to make sure that the people with the highest needs were absolutely linked to other services. We were fairly successful in doing that, and then we made multiple attempts to reach out by mail, by phone. Actually, some people actually went out to houses and tried to locate people. So I can't say that 100% of people were actually transferred. We have made contact with 100% of the people that we are aware that were enrolled at Columbus area.
Okay, thank you. That's helpful and important, by the
Yes.
way. But I may go to the director, or if the title is CEO, interim CEO, Dr. Dixon. Do we know if, and I don't hope this isn't out of line for asking this, but this is important. The Columbus Area Inc. scenario had a variety of financial commitments, obligations, and challenges. Has that been cleared up, or is that still a part of the sort of ongoing arrangements? And are there any budget implications for that current situation?
Yeah, I'm gonna ask Mark to respond in detail, but things continue to go through bankruptcy court, but Mark can bring you up to speed on particulars related to ongoing financial obligations related to that organization.
Sure. Good afternoon.
Good afternoon.
So yes, Columbus area has declared bankruptcy. It is in the bankruptcy court now. It just actually was filed, I think, 2 weeks ago. Where they're at with, as far as the process with that goes, there's going to be a creditors meeting. It's going to be held, I think it's December 7th. So all the debtors and creditors can get together and discuss things and make sure everything is quantified and identified within the bankruptcy filing. And then next year, we'll have to be able to formally submit whatever type of liabilities that Columbus area had for us. At that point in time, we'll submit those. At this stage, their assets.
I'm sorry, liabilities?
Well, I'm sorry, it would have been a Columbus area liability to us, accounts receivable
okay.
for us, accounts
Okay.
payable for them.
Okay.
We submitted the preliminary paperwork to the bankruptcy attorney that's been assigned. And then in next year, we'll actually do another formal approach with that. It's really a matter at this point in time how much assets they had. What we could identify from the assets they had when they closed on April 30th was pretty small dollar amounts. They didn't have any facilities anymore that they actually owned, so they were actually leasing those things out. Their bank statements and things of that nature were pretty thin as well, so we're not anticipating to be able to recoup any types of receivables that we have with them.
Okay, thanks, Mark. My final question, Madam President. Okay.
Sure.
Are there any obligations of Franklin County, or ADAMH, rather, with regards to the agreement?
No,
With
sir.
regards to their, not agreement, but the closing of Columbus area?
No.
Okay, perfect. Thank you. Thank you.
Moving on to the opiate epidemic. Everyone here hopefully is aware of the Addiction Stabilization Center. This is a program that was identified in the Franklin County Opiate Action Plan and opened in January of 2018. When the Opiate Action Plan was created, we heard resoundingly from first responders they needed somewhere to take individuals upon overdose to get immediate access. So we responded by creating this facility. It's on South High Street. It's a 55-bed facility operated by Mary Haven. It has 3 levels of care: triage and admission, detox services, and residential services. If a person is medically cleared, EMS can take them directly to the stabilization center, so they don't have to take them to a hospital if they would like to go there to receive services. If a person who has overdosed ends up in the emergency emergency room at any of the hospitals. We have another service called REACT, and REACT works with all of the emergency departments. They will go into the emergency departments, engage with individuals, and then transport them to the stabilization center and or get them linked with care. The center has doctors, nurse practitioners, clinical staff, and peer recovery specialists. In 2018, they served 1,500 individuals. This year, so far, they've served 1,343 individuals. Mobile crisis response. We have done a number of things trying to prevent people from being in crisis, divert them from going to the emergency departments or ending up in jail. So we've partnered with NetCare, Columbus Division of Police, and the Franklin County Sheriff's Office to create mobile crisis response teams. From October of last year through September of this year, looking at Columbus Police Department calls, 5,040 calls for services were dispatched. 864 individuals were transported, but only six people of all of those people that were transported for services. So they resolved most of those calls in the home or in the location. 863 had to be transported to an emergency department or to NetCare. 6 of those individuals were transported to the jails. So of all of those calls, 6 were transported to the jails, which I know is important to the commissioners. We really, through the Stepping Up initiative, we really want to keep individuals who have a mental illness or substance use disorder out of the jails. I mentioned this earlier, I'll mention it again, with REACT, which is an initiative through Southeast. We have clinicians who go into the emergency department will respond to overdose individuals and get people linked to care in the community. Suicide was the 10th leading cause of death in the United States in 2017, when more people died by suicide than by homicide in Franklin County, Ohio, and in the United States. So we have spent a lot of time focusing on our suicide prevention efforts. ADAMH continues to expand that work. You'll see up there, we have expanded what we do with our suicide prevention hotline through North Central Mental Health Services. They receive an average of 9,300 calls each year from area residents. They have extensive training for the volunteers that work with them, and we've recently supported expanding their suicide prevention hotline to include texting options. Franklin County LOSS, which is an acronym that means Local Outreach to Suicide Providers. We funded services through Franklin County LOSS to provide support to families who have lost a loved one to suicide. We've recently expanded our support with them to offer trainings, which is a QPR, Question, Persuade, and Refer training. If you're familiar with mental health first aid, it's similar to that. The training gives 3 simple steps for anyone to help save a life. So it teaches them how to question, persuade, and refer someone who might be considering suicide. Lastly, I would like to talk about the Franklin County Suicide Prevention Coalition. We infused dollars to Mental Health America of Franklin County to help revitalize the Franklin County Suicide Prevention Coalition. They have a website now. They just did a first responder training in November of 2019. There's more to come through the efforts of that Suicide Prevention Coalition. Before I move on to another area outside of health, I would be remiss if we didn't talk about the Guardianship Services Board. So there's not a slide for this, but through the leadership of the county commissioners and Judge Montgomery, we've been very supportive of the Guardianship Services Board and getting people that are in our system in particular linked to a guardian who can help ensure that they have the adequate care that's needed. Moving on to housing. We know that In the Rise Together plan, stable housing is critical for all families in Franklin County. We know that there's a shortage of affordable housing in this county. We also don't have enough housing for people who have a severe and persistent mental illness or who are in recovery from a substance use disorder. Residential services are also an important part of a successful continuum of care. There are a few areas where we have expanded housing options in Franklin County, and I will focus on our newest project, Creekside Place. Sorry about that. Creekside is a permanent supportive housing project. So it is, permanent supportive housing means that they have someone on site 24 hours a day who can assist individuals. They provide after-hours services. They engage. There's groups on site, that sort of thing. In addition to Creekside, we've also supported recovery housing. Most recently, with Community for New Directions, we funded a level 3 recovery house, which is a more intensive level of recovery housing. So an individual will be engaged in treatment and also live in this recovery house where they have supportive services on site as well.
Catherine, is that level 3 housing at the same site as Creekside?
It is not. So I don't actually know the address of the.
Is it in the same area or?
No, it is near campus.
Okay.
We have 2 level 3 recovery houses in Franklin County. C&D operates one, and it's in the campus area. House of Hope operates the other one, and I believe it's on Parsons.
Okay.
So, going back to Creekside, it is it's slated to open in 2021. It will have 24/7 crisis intervention on site. There will be on-site supportive services. It's a 63-unit project. 40 of those will be ADAMH consumers. It's important to mention that this is a partnership with many individuals. It's a $13 million project. ADAMH is contributing $650,000 to the capital cost, and then once it's up and running, we will allocate an additional $170,000 for services. We worked with Columbus Metropolitan Housing Authority last year on an application to HUD, and we were successful with obtaining mainstream vouchers. So 50 of those vouchers will be utilized for this Creekside project once it comes online. Moving on to jobs. People with mental illness and or addiction issues can and do recover. And so we want to ensure that individuals in our system have the opportunity to have successful employment. Sometimes that's through peer recovery support services. We also have a number of initiatives that are employment related, and I'd like to talk just a little bit about those. This year, NetCare, Community Support Network, and National Church Residents have hired peer recovery specialists to work in their organizations. All staff working as peer support specialists must hold credentials that is available through the Ohio Department of Mental Health and Addiction Services. Peer support is a service that allows individuals to use their lived experience with mental health and substance use disorders to inspire others, give encouragement, and empower them to live their best life. So if someone has overdosed and a peer comes into the emergency room, they're much more likely to relate to that individual than a clinician who's never been where they've been. Currently, there are 166 certified peer recovery support specialists in Franklin County. This past year, we worked with Mental Health America of Franklin County to help us coordinate trainings and guide people through the certification process with OMAS. We also asked Mental Health America to do a survey for us regarding peer support. So they surveyed employers and peers in Franklin County about the strengths and challenges both groups have when hiring peer support specialists. Oh, sorry. The survey so one of the things that came out of the survey was that ADAMH recommended and encouraged providers to hire peer support specialists and pay them a minimum of $15 per hour. Now, not all providers are there, but we continue to promote that as a baseline for payment. Pathway Clubhouse, which is another initiative, is now operated by Concord Counseling. This was a Columbus area initiative that we transitioned at the beginning of this year. So Pathway Clubhouse is a service that's located on East Broad Street. There are activities there where members come, they gain work experience by helping assist with the function and running of that facility every day. There's also on-site training that goes on there, and some members participate in a transitional work program, working an average of 20 hours a week in a variety of settings outside of the clubhouse. Staff from the clubhouse provide assistance to help members find independent employment based on their education, skills, and preferences. Moving on to youth. Ensuring that all youth are on track for long-term success. Here we have identified just a few of the initiatives that we have been involved with over the years. Multisystemic therapy was created a few years ago. That is a home-based service to reduce severe behavior problems, and that is a partnership with ADAMH, Franklin County Children's Services, and Franklin County Family and Children First Council. Referrals come from Children's Services, Juvenile Court, and the ADAMH system. Another initiative is functional family therapy, That is a family-based intervention program for youth at risk of being removed from their home. And that is funded by ADAMH. I am going to turn it over to Dr. Dixon to talk about some of the other prevention programs.
This is regarding some of our summer and after-school programs. ADAMH funds 26 summer learning opportunities that served more than 2,600 youth this past summer. The kids who attend the camps learn about the harmful effects of alcohol and other drugs on their body and on their lives. But they also acquire and effectively apply the knowledge, attitudes, and skills necessary to become responsible adults, such as understanding and managing their emotions, set and achieve positive goals, feel and show empathy for others, establish and maintain positive relationships, and to make responsible decisions. A lot of this work happens through our social and emotional learning component of the summer camp and strategic prevention framework. This year, we established programs at 4 high schools, and the students from the neighborhoods where the camps took place were summer interns working at those summer camps. They received internships and internship credit at school, received experience for future employment and college applications. They made connections with youth at the summer camps because they can relate, and that's so critical to have kids that are living in those neighborhoods, young people that are living in those neighborhoods, come back and share and work with the other youngsters in those communities. Columbus Public Health offers also a curriculum in the after-school programs in summer camps called YES, Brain Power, and Real Life. A couple of programs that we funded. One was the Life Sport program at The Ohio State University. It's a 4-week summer program that's in conjunction with the College of Social Work and is funded through the OSU Spring Game. And they provide a lot of summer supports for not only the youth, but also booster sessions with their families involved as well. And that's this summer we had, or I think it was last summer, we had a number of individuals to go out and take a tour of that. And thank you, Commissioner Boyce, for joining us for a half a day to come out and watch those young people who may walk on campus upwards of 10 miles a day. So again, it's about nutrition, it's about health, it's about social emotional learning. They have chalk talk sessions where they can also engage each other and figure out how do we solve problems together? How do we work better as a team? And then they also are engaged in traditional sports, volleyball, they learn how to swim. They have other kind of engaging activities that really traditionally they don't come in contact with unless they go into a summer camp program like that. And then the other one I want to just quickly feature is the Paragon Project. This summer, working with the Urban Minority Alcoholism Program and also Fort Hayes, there's a group called Paragon, and this group gets together into a recording studio and puts together a presentation around living with depression, living with parent abandonment, living with homelessness, and they put together this CD that they share among other young people. And it's a wonderful opportunity for these young people to learn, experience all aspects of this business. And Dr. Tony Anderson works closely with them. And this past year, he connected them with the group called The Roots. I'm not familiar with them, but I heard a lot of people are. And they went out and met with them and learned from a professional recording industry folks to put this together. So we're really excited about that. Ohio Opioid Education Alliance, and this is around the community education awareness, over 80 public and private partners as a part of this. $2.25 million for the opioid PSA paid by the alliance partners. And we want to thank the commissioners for their $250,000 commitment in 2019 and also 2020. Don't Live in Denial Ohio campaign that you've probably seen on television. The important partnerships that is expanding statewide and receiving national media coverage and awards. The goal is to encourage parents to talk to their kids about drugs and disposal of leftover medication. Just really quickly, 50% of those surveyed in Central Ohio say they have seen the ads, and 57% of those who have seen the ads are taking action by discussing the dangers of opioids and prescription painkillers with their children. But there's still a lot of work to do in this area, as you all know, and we continue to do that. For more information about ADAMH, it's 614-224-1057 is our phone number. And then we have the website at www.adamhfranklin.org. We also have Facebook, we have Instagram, we have LinkedIn, and we have texting 22828. A lot of the stuff I'm still trying to learn about. Thank you very much for allowing us to share some information. If you have any questions, I'm sure one of our folks would be glad to answer them at this time.
Dr. Dixon, how big is the coalition on Denial Ohio, if you know, or if somebody knows?
Yeah, it's about
There's currently over 80 members.
80 members from all sectors. In fact, we just had a First Congregational Church and Faith Ministries Church to join as two independent faith institutions because they're doing a lot of work within the community. They're providing Sunday services that are talking about mental health and addiction issues, and they're having speakers come in. So it's a really wonderful model with our faith-based partners.
Madam President, may I?
Sure.
To build on that question, do we know how much overall has been spent on the campaign, and then also how much overall the county has put in through various resources?
I'm going to ask Amy to share that information.
If you don't have it now, you can
No,
just get it to
okay.
me. I'm
We'll
just
get it to you.
curious as to what that is.
Yeah.
I can add a little bit to that.
Yeah,
So
sure.
as far as different agencies in Franklin County that have contributed, Franklin County Children's Services has had a multi-year commitment. The Board of Developmental Disabilities has made commitments as well. Of course, the Franklin County Commissioners has as well. Those are the three agencies within Franklin County that have, along with the ADAMH
Right,
Board.
But do you know how much those are?
The county commissioners, it was $250,000 in 19 and 20 both. Franklin County ADAMH Board is $250,000 last year, or I'm sorry, in 2019, and just over that in 2020. And I'm trying to remember the other two, and I don't want to get it wrong. I believe it was $75,000 per year that Children's Services has contributed annually. I think they had a 3-year commitment to that. And I'm trying to recollect off the top of my head, Developmental Disabilities Board, what they contributed. I had to get back to you on that.
Okay.
Isn't the vast majority from the business community?
Sure, yes,
The
it is.
vast majority of the budget?
Yeah, there's over 60 organizations that, on the private side, that the Columbus Foundation is collecting those resources, and then we actually request funds from them as needed as well.
Yeah, actually, what I was really trying to get at was trying to see how big the impact was, and what, our contribution to that impact was. So, for example, if, let's say, the overall campaign was $5 million, you know,
Yes.
and if the county put in $1 million, then I was trying to gauge what that
I
looked
understand.
like.
Yeah.
So,
And overall, I think we're getting close to $3 million in expenditures this year.
Okay.
We're anticipating next year to be up to $5 million. I know that they're not only going to do the traditional commercials and things of that nature, but also going to do a lot more outreach. I know they're talking about working like with the Ohio High School Athletic Association as an example. They do work with them. Also, a lot of faith-based initiatives and things of that nature. And then it'd be remiss also, the Ohio Department of Mental Health and Addiction Services has also committed $500,000 in 19, and they're working on an additional $500,000 probably for next year that will be used for statewide campaigning as well.
interesting. Okay. Great.
Any other questions?
I don't have any.
The work that you do and the programs that you fund make a difference in so many people's lives. And I know I speak for my colleagues when I say thank you. Thank you very much.
Madam President, I'm sorry, I do have
Yeah.
a comment. Thank you for all the work that you guys have been doing, working with the coalition, with our, what do you call it, our I'm at a loss here, all of our partners on the opiate task force, the work that David Royer started with the organization and all the different partners that are involved has been invaluable, and so we appreciate everything that you guys have done. A lot of people put in a lot of time, and a lot of effort, a lot of hours. You know, there's just been a huge amount that's been done. I know that we've made an impact here in Ohio, and so not just here in Franklin County, but across the state. So we appreciate all that you guys have done and the staff has done at ADAMH.
And the amazing thing is the amount of partners that have come together and saying, this is just not an ADAMH problem, this is a community problem.
It's a community issue.
And they're all stepping up to the plate and providing resources, information, sharing some of their staff resources as well. So it's been really, truly a partnership in all the sense.
Absolutely, and there's more work to do,
Yes,
so thank you.
thank you.
Thanks.
Thank you for your time. Appreciate it.
We will get started with Children's Services in just a minute.